In dystonia, your muscles contract involuntarily, causing uncontrollable repetitive or twisting movements of the affected body part. Your symptoms may be mild or severe, and may interfere with your performance of many day-to-day tasks. Please like, share, comment and subscribe. Thank you for your love and support. Doctors divide dystonia into categories including generalized, focal, segmental and other less common categories. In focal dystonia, the most common category, one part of your body is affected. Generalized dystonia affects most or all of your body. In segmental dystonia, two or more adjacent areas of your body are affected. Some types of dystonia are inherited. Medications can sometimes improve dystonia symptoms, but inconsistently. In some more severe cases, surgery may be used to disable or regulate certain brain regions or nerves. Dystonia symptoms include involuntary muscle contractions that cause repetitive movements or distorted postures. Begin in a single area, such as your foot, hand or neck. May occur during a specific action, such as handwriting. May worsen with stress, fatigue or anxiety may become more noticeable over time. The impact of dystonia on your quality of life varies depending on the part of your body affected, the type of dystonia and the severity of your muscle contractions. Areas of the body affected may include eyelids. Rapid blinking or involuntary spasms causing your eyes to close, blepharospasm, can make you functionally blind. Neck. In cervical dystonia, contractions cause your head to twist and turn to one side, or pull forward or backward, sometimes causing pain. Face, head and neck. In craniofacial dystonia, your face, head or neck muscles are affected by contractions. Oromandibular dystonia affects your jaw movement or tongue and may cause slurred speech or difficulty swallowing. Vocal cords. Some forms of dystonia affect muscles that control your vocal cords, spasmodic dysphonia, causing a tight or whispering voice. Hand and forearm. Some types of dystonia only occur while you're conducting a repetitive activity. In musicians' dystonia, your ability to play a specific instrument may be impaired. In writer's cramp, your hand and forearm muscles are affected while you're writing. Dystonia also may occur during other specific tasks. Doctors don't know exactly what causes most cases of dystonia, but a few factors may be involved. Altered nerve cell communication dystonia may be linked to altered communication between nerve cells located in the basal ganglia, an area of the brain involved in initiating muscle contractions. Genetic changes dystonia sometimes may be inherited. Researchers also have discovered many genetic changes associated with some inherited forms of dystonia. Other disorders. Sometimes dystonia may be a symptom of another disorder or condition, including Parkinson's disease, Huntington's disease, Wilson's disease, traumatic brain injury, birth injury, stroke, brain tumor, paraneoplastic syndromes, oxygen deprivation, infections, such as tuberculosis or encephalitis, reactions to certain medications, heavy metal or carbon monoxide poisoning. To diagnose your condition, your doctor will review your signs and symptoms and conduct a physical examination. You'll be asked to provide your complete medical history, including any family history of dystonia, previous head injury or stroke, or exposure to toxins or drugs. Dystonia can't be cured, but doctors can provide you with several treatments to improve some of your symptoms. Other medications that act on neurotransmitters, including diazepam, Valium, clonazepam, clonopin, lorazepam, Ativan, baclofen, Lioresal, may help some forms of dystonia. These medications may cause side effects, such as drowsiness. Therapy. Physical therapy. Physical therapy or other therapies may help improve your symptoms. Speech therapy. If your voice is affected by dystonia, speech therapy may be helpful. Sensory trick. A sensory trick, which involves touching your affected body part, such as your face, may help reduce your contractions. Surgical procedures. Deep brain stimulation. In deep brain stimulation, surgeons implant electrodes into a specific part of your brain. The electrodes are connected to a generator implanted in your chest that sends electrical pulses to your brain and may help control your muscle contractions. Your doctor may adjust your settings as necessary to treat your condition. Your surgery may involve risks, including infections, stroke-like problems and speech difficulties. Surgery. Surgery rarely may be an option to treat some types of dystonia which haven't been successfully treated using other therapies.